Hi, and welcome to two4MK, where we answer your questions. Today I'm here at the Tulaski Center at 3300 Main Street, where there are a whole variety of medical specialties, including behavioral health, neurology, women's health. And my guest today is Dr. Valerie Sharpe, who is going to talk to us about some of the unique programs that are going on in the behavioral health space. So welcome, Valerie.
Thank you for having me.
So tell us a bit about the Integrated Behavioral Health Program.
We know that primary care providers are sort of the front line in treating patients with psychiatric conditions. They really treat the majority of our patients with psychiatric conditions, which can get very overwhelming. What we do to sort of fill that need is to go over to primary care clinics that are affiliated with Bay State to do one-time psychiatric consultations to clarify the diagnosis and then provide treatment recommendations that we pass on to the primary care provider so that they can feel comfortable managing the patient's somewhat complex, often complex psychiatric needs.
I understand you're using some new modalities to treat depression.
Mm-hmm. We're very excited about a new program that started in the summer of 2017 called transcranial magnetic stimulation, or TMS for short. Mm-hmm. So it's been around for about 10 years, but insurance is finally really covering it. So we're seeing a lot more of these services being available to our patients. And what we use is a magnet that delivers pulses to stimulate certain parts of the brain that are underactive in people with depression. So it's a really useful treatment for people with treatment-resistant depression and also people that can't tolerate medications because of side effects. Because it's not systemic, it's very low risk of side effects. So low risk, in fact, that the psychiatrists that actually do the treatment practice on ourselves. So we've all done brain mapping on each other, and we know exactly what it feels like, so we can tell our patients about it. It's like a woodpecker tapping on your head, so a lot of TMS sites actually have like a little figure of a woodpecker or something, because everybody describes it as that.
Yeah.
So.
Well, thank you for visiting with us, Valerie. Really appreciate it, and thanks for the work you're doing for our patients.
Thank you.
Now let's get to your questions. The first one is, how do you think that we can end the opioid epidemic in our communities and our country? Well, I'm not sure we can ever end it, but I think we could do a lot better. And I think we could learn a lot from some of the other countries in the world that have been successful in containing their problems. I read an article last year about Portugal that has succeeded in getting its opioid overdose death rate down to 50% lower than what we're seeing in the United States. They used a four-pronged approach, and some of these things we're doing today here in Western Massachusetts. First is to regard the problem as a medical one, not a criminal one. Second, to use a multidisciplinary approach and not just think of it as a narrow law enforcement kind of problem, so social work, medical, education, etc. The third is to think of alternatives to opioids in people who have acute pain. And then fourthly, to make medication-assisted treatment, such as methadone or Suboxone, readily available as part of our primary care system. If we did all those things, I think we'd make a big dent in the problem today.
Hi, Mark. I'm wondering if you could be in any movie, which one would it be and why?
I thought a lot about this, and I followed a very scientific approach. I took a look down at my DVD collection at the 20 or so movies that I could watch again and again, and immediately rejected the ones where the hero died, because who wants to be the guy who dies at the end of the movie? Looked at Groundhog Day with Bill Murray, thought that might be kind of a fun role to be, but the one I landed on was the movie Get Shorty with John Travolta, where he plays a guy named Chili Palmer, who's a two-bit gangster who is trying to collect on a loan sharking deal and then winds up going from Miami to LA and falls in love with the movie business and decides to go into the movie business. The reason I chose this one is Chili Palmer is cooler than I could imagine being, and he gets himself into all kinds of jams and manages to almost magically get out of them through his own charm. And so if I could be in any movie, and if I could be any movie character, I'd be John Travolta as Chili Palmer in Get Shorty. So thanks for your questions, and keep them coming.
The plane.